When you evaluate a problem and you do a real good, thorough job of looking at all angles of this problem and everything just makes sense, then we're getting closer to the truth.
I know a lot of you have watched videos about mental decline, but here is why this video is a game changer. It presents a comprehensive and user-friendly analysis of Dr. Eric Berg's extensive collection of dementia videos. This distills a clear perspective on memory loss and dementia. Dr. Eric Berg is a renowned expert in the field of health and wellness, especially recognized for his knowledge in nutrition, ketogenic diets, and intermittent fasting. He is the author of the Amazon bestseller, The Healthy Keto Plan, and has collaborated with over 40,000 individuals, including senior officials in the U.S. government and medical doctors. To kick things off, we'll need Dr. Berg's perspective on the trendy problem of memory loss and dementia, which includes starting with a foundational explanation of dementia, setting the stage for a comprehensive exploration of its symptoms, causes, and the often misunderstood nuances that come with it. Stay tuned as we embark on this dementia journey together.
Dementia in Alzheimer's is a situation where your neurons cannot get fuel anymore, specifically glucose, because there's either resistance of fuel going through the blood-brain barrier, or the neurons in the brain itself cannot get fuel anymore. So there's a problem with these synapses connecting.
According to Dr. Eric Berg, dementia is often related to vitamin deficiencies. These deficiencies are more than just a health concern. They can often present symptoms that closely resemble those of dementia. Understanding these can be crucial in preventing misdiagnosis and ensuring proper treatment. Let's pay close attention as Dr. Berg elucidates the critical function vitamins serve in preserving our brain's health.
All right, what is the most important vitamin for the brain, okay? And if you're deficient, can create all sorts of cognitive problems. Well, that would be vitamin B12. B12 is from animal products. So if you're not consuming animal products, you probably are going to be deficient unless you take it as a supplement. There's several other really important vitamin deficiencies and a mineral deficiency that is related to dementia that you have to be aware of. B1 is a very common one, especially with the area of the brain that's involved with memory loss, and that would be the hippocampus. The hippocampus is the part of the brain that's involved with memories. Now, they don't know exactly what it does, but they do know when the hippocampus shrinks and has neurodegeneration or atrophy, then you get Alzheimer's. And not just a B12 deficiency, but a B1 deficiency can actually create damage of the hippocampus. It can create the same damage as a lack of oxygen, hypoxia. Okay, so B1 is very, very important. It's important as a cofactor in the metabolism of the mitochondria that generates energy for the brain. So without B1, the nerves cannot work, and you literally starve off the fuel for the brain. And the number one cause of a B1 deficiency is consuming too much sugar or carbohydrates. You see, the more carbohydrate that you give the brain to run on, the more B1 you need. So the high carb diets increase the demand for B1. And so usually people don't have enough B1. And so that creates more of a deficiency. And now you're left with a situation where your hippocampus starts to suffer. It starts to break down. And then you're having problems with memory, locating things, confusion, coming up with solution to problems. Zinc is another key nutrient involved with hippocampus. If you have a zinc deficiency, you'll have a tendency to develop amyloid plaquing in the brain, which you see in Alzheimer's. Now, how do you become zinc deficient? Probably also because you're consuming too much sugar or carbs, but also something called phytic acid. Phytic acid is in the grains, it's in the breads, it's in the pasta, it's in the crackers. So that phytic acid blocks zinc, which can then cause these symptoms right here. So zinc is another important nutrient. And then we have vitamin D, okay? If you're deficient in vitamin D, which most of the population is deficient, you can go from a mild form of dementia to a severe form of dementia a lot faster. So vitamin D slows the process of developing damage in your brain. And of course, vitamin D comes from the sun. It's very difficult to get it from the food, but it's in fatty fish, dairy, it's in cod liver oil.
Transitioning from vitamins to medications is a crucial discussion. Yes, the medications we rely on to alleviate our ailments and enhance our quality of life can also have unintended effects on our cognitive health. These effects may mimic cognitive disorders like dementia. Dr. Berg will address this issue and, in addition, highlight other nutritional deficiencies that can lead to similar cognitive challenges. This segment is particularly important for those navigating the complexities of medication management and seeking a balanced approach to their health.
Another really common cause of dementia are the side effects from medications, especially antacids, bladder medications for bladder control, sleep aids, antidepressants, medication for anxiety, cholesterol medication, statins, blood pressure medications, corticosteroids, and alcohol. So in other words, if you're starting to get dementia symptoms and you're on some of these medications, get that medication out and start looking at the side effects. It could be as simple as some medication that is causing you to have dementia. In fact, it's very, very common. I mean, can you imagine not really evaluating these side effects, right? And then you have dementia and you're on another medication for that potentially can give you another side effect that you take another medication for. I'm telling you, there are so many side effects that are then camouflaged with other medications. And there's no way to know if your symptom is coming from that unless you come off that medication. Of course, check with your doctor.
If you are not already a subscriber of my channel, please go ahead and subscribe to my channel and share this video to whom might benefit best. It is worth turning our attention to an extraordinary source of energy for our brains: ketones. These powerful substances offer a promising alternative to glucose, especially for those facing the challenges of dementia. We will explore insights from Dr. Berg on methods to elevate ketone levels, the underlying science of ketones, their significance in brain health, and the potential they hold to transform our approach to cognitive disorders.
The most important thing you need to know is you need to start feeding the brain ketones, okay? Ketones will bypass this damaged mechanism of the glucose being absorbed and feed the neurons directly. So you're going to notice a nice change in these symptoms for the better. So how do you increase ketones? 3 ways. You lower your carbs. Get on a healthy keto eating plan. You start doing fasting. I have a link down below of how to do intermittent fasting. Going on low carbs will increase ketones a certain amount, but when you're doing fasting, you greatly elevate the amount of ketones that the brain can use. Now, the other thing you can do as a transition step and to enhance this process is to start taking MCT oil, which will give you ketones directly. You can also take exogenous ketones in a tablet form. They're a little more expensive. This is a lot less expensive. But the key is getting more ketones in the brain. That is going to immediately start turning things around for you.
The practical and effective steps that can be taken when symptoms of dementia appear range from understanding the importance of vitamin B12 to modifying one's diet, among other strategies. But let's see what Dr. Berg recommends, because Dr. Berg's advice is grounded in research and aimed at empowering individuals with the knowledge to make a positive impact on their cognitive health.
So if you have signs and symptoms of dementia, this is what I would recommend, okay? I would recommend getting on a keto diet immediately, okay? The healthy version with fasting, because out of all the things that you can do, running the brain on ketones would be the best thing you could do, because it'll bypass the damage in the hippocampus and feed the neurons directly from a different way and actually help slow down this degeneration. Number 2, fish, fatty fish and seafood, okay? Seafood will give you the zinc. It will also give you the omega-3 fatty acids, DHA, but also fatty fish like salmon will also give you both of those nutrients, as well as vitamin D. Red meat for B12, another important thing. But if you're deficient in B12, red meat will give you all you need. Now, this other thing with the stomach, if your stomach acids are not strong enough, This is a really good remedy. It's called betaine hydrochloride. You want to take like 5 of these right before you have a meal. And that will slowly start building up the acid in the stomach, as well as the absorption of B12. So this is a really good plan if you're starting to get this symptom of, what is that? Dementia.